What are 4 fears that people have about their pelvic floor? Well, the number 1 fear people have is having an accident in public, right? Peeing yourself by accident, or losing stool, losing feces or gas in public. And doing your pelvic floor homework that your pelvic floor physical therapist has given you will hopefully prevent that. And you'll have less and less episodes of that, hopefully not in public anymore. But really commit to doing the therapy. Try not to give up or feel discouraged. Being diligent about doing your homework exercises is what's going to keep you from having accidents in public. Second fear that people have about their pelvic floor is losing intimacy with their partner because of painful intercourse. So sometimes having pain with intercourse forces people to just not be in intimate situations with their partner. There are other ways to be intimate. Some pelvic floor physical therapists are sex counselors, and there are sex therapists out there who can give you tips on how to be intimate without being physical, or intimately physical. But this is a fear, and if you work with your pelvic floor physical therapist and with your partner, then you can work towards having pain-free intercourse and being intimate again. People worry about also the symptoms getting worse, and sometimes physical therapy doesn't always work, and yes, symptoms do get worse over time, but this is something you need to talk about with your medical provider. There are other options or other medical interventions and devices that your medical provider can give you if the therapy isn't working. But keep trying with the physical therapy, because we're all about conservative treatment. Another fear that patients may have about pelvic floor rehab, pelvic floor in general, is needing surgery. So there are surgical interventions that can help with a dropped bladder or different issues with different organs in the pelvis and with the pelvic floor muscles, but we believe in at least doing pre-op rehab so that you can rehab quickly post-op. So even if surgery is on the table, then think about seeing a pelvic floor physical therapist for education and to learn about the pelvic floor and doing exercises so that you can rehab that much quicker after the surgery.